So what about safety when it comes to the topic of regenerative medicine or regenerative injections? Let's talk a little bit about that today. I'm Joya Vanderlaan. I'm a functional medicine and regenerative medicine family nurse practitioner. It's a mouthful, I know. I'm located in Illinois, licensed in a bunch of other states as well. With regenerative medicine, oftentimes people's maybe number one or one of their top concerns is safety. Is this safe? It's not as commonly known about, and when they find out about it, of course they want to know if it's as safe as the other, more used interventions for things like pain and arthritis and joint degeneration. It's a fair question. Inherently, regenerative medicine is going to be safer than things like surgical options, and even arguably safer than things like doing NSAIDs or steroid injections or other medications that can help to manage some of the symptoms that regenerative medicine would actually help to cure and heal. So a couple of the options, especially the ones that we use in my practice, are PRP and ozone, peptides, and then of course stem cells, which usually come from Wharton's jelly or amniotic fluid. So let's start with the Wharton's jelly or amniotic fluid, because that tends to be the one that people could and do have the most questions about when it comes to safety. So, and ethics as well. So just to put your mind at ease, the umbilical cord tissue or Wharton's jelly tissue or the amniotic fluid, the purified amniotic fluid that is used to create these products is highly purified, first of all, tested, highly tested. Donors are highly screened, and the mothers, babies from whom these tissue samples are collected are mothers and babies who are healthy, and the babies are going home with their families. This is not a situation where a life has been ended to collect these tissues. There are rigorous standards for collecting and processing these products so that they are safe. The industry really wants to be successful, and so it's in their best interest to provide a good product. Now, that said, there are some labs out there who do not uphold the high standards that the labs that I use to source my product do. And so there are certain labs from which I would never order stem cell or any regenerative products. I am confident in the labs that I do choose to use, and that's why I'm confident in using these products very, very safely in patients. PRP, again, very safe. This is platelet-rich plasma, and it's actually a product that comes from your own blood. So the procedure is very simple. We draw the patient's blood, a simple blood draw, 1 tube, sometimes maybe 2, although 1 is usually plenty. We spin it in a very special centrifuge, and this very special tube separates the layers of blood and plasma and platelet-rich and platelet-poor plasma, and then we just draw off what we need, that PRP, from the tube, and inject it into the knee or the shoulder, or wherever we're injecting it. So there's no chance of rejection because it's your own blood. It's from your body. It's going back into your body, just concentrated healing factors. I never do 2 people's PRP at once, and so there is literally 0 chance of mixing up anybody else's PRP with your PRP. You will always get your PRP back. A peptide therapy is also really interesting, and often now on my discovery calls with patients interested in regenerative therapy, they're asking about things like BPC and CJC and maybe not Pentosyn. I can sometimes tell them about the Pentosyn. But the BPC 157 is actually a really great option and a little bit less expensive option to start with. Oftentimes I'll even advise patients to start with the BPC or other peptides to see if they don't want to spend the few $1,000s on stem cells right away, or maybe if it's not necessary. Of course, we can start with the BPC or even PRP and see where that gets us. We can even combine BPC and PRP, or BPC and stem cells, or stem cells and PRP. So there's not really one right way to do this. It kind of depends on the patient situation, how aggressively we want to treat it, and of course budget as well. Ozone therapy is another one that's not so commonly known about actually, but ozone therapy, even injecting ozone into a joint or into tissue, can be very regenerative and anti-inflammatory and help really manage pain well. So again, oxygen tank, pure medical oxygen, ozone generator, draw up a little bit of that ozone and inject it very skillfully into the area that's needing regenerative therapy. If you have any questions on the safety of stem cells or other regenerative injections, I'd be happy to try and answer those for you. If I get too many comments, I might not be able to answer them all, but so far I don't think that's going to be a problem. If you have any questions, you can schedule a discovery call, and that can be done on our website, nourishhousecalls.com, and then you'll get to speak to me, and I can kind of go over your case with you and see what might be your best option for regenerative treatments.